So, Yamandumarang, I hope you're well today. My name's Alison Barnes. I'm a registered nurse, but I also have long COVID. And today I wanted to talk to you briefly about lived experience. So, yeah, that's what we're going to do briefly. That's the important bit. So, we're going to have a little look at what it is. How can I use it in my practice as a nurse or midwife or a doctor or any other healthcare worker? I'll talk about nurses because that's what I know. How can understanding lived experience help our health system? And what are the final tips and takeaways? Because there's always a takeaway. So, what is lived experience? It is exactly what it says on the box. It is when a person has lived through the experience of a situation, a condition, an illness. So, when I talk about long COVID, I don't just talk about it from the perspective of a nurse, even from the perspective of a primary healthcare nurse, which is what I used to be. I talk about it from the experience of and from the perspective of somebody who has long COVID, diagnosed by a doctor. Because people often ask me, "Are you sure it's long COVID?" Like, I don't know, because I do know. It's very frustrating. So it is exactly what it says on the box, nothing more. How does understanding lived experience make me a better healthcare worker? Because we're all time poor and we only care about how it's going to help me. I get that. I remember. So, understanding the experiences of your patients makes you more compassionate. It makes you kinder and more caring as a healthcare worker. And I mean, I'm old, let's be honest. But I think kindness and caring are still the things, the values that underpin nursing as a profession, or they should be. You can feel differently, that's up to you. But I think if we understand the experiences of our patients, we can provide better care. And it might be about providing care in a practical sense, or it could be about being better at caring for people, caring from your heart, from in here. Because often that's the thing that patients remember most about their experiences inside the health system. It's how kind the nurse was who brought me a warm face washer to wash my face when I couldn't get out of bed. It's about the nurse who noticed I was shivering and brought me an extra blanket. Or it's about the nurse who didn't notice I was shivering and laying in bed under my raincoat because nobody had given me a blanket. They're the things that people complain about. And I know I've worked in the governance office of a large local health district. I remember, but I've also been a patient, so I know. And lived experiences about understanding the experiences of our patients. You can also use people with lived experience in co-design if you're looking at developing services into the future. You can look at, if you're redesigning your health services, you can look at asking people who use those health services, what would make it better for you? That's understanding lived experience. And very importantly, because this is what I do day to day these days, you can use lived experience to inform your practice as a researcher. That's very important. It will mean that you're doing something that's actually meaningful, not just what healthcare workers think we need. Because what you need as a healthcare worker is often different to what I need as a patient. It's just looking at it from a different perspective. Makes us kinder, makes us more caring, it makes us more empathetic. And empathy, even if you don't know that you have it, is a skill that you can learn. So how do you think it makes the health system better? Well, I can tell you, save you some time. Um, the health system can be better if they talk to people with lived experience, particularly in the planning phases. But if you're redesigning a system, talk to people who use that system, and you can get a system that's easier to use, something that generates fewer complaints, which is less work for us as healthcare workers. Just saying, you know, we can make our own lives better. We talk to the people who use our system. We can provide care that is actually what patients need and want. We can provide care that makes patients feel cared for. And the care that we provide and making patients feel cared for, they're not always the same thing. Particularly if you have, like, long COVID is an invisible illness. I have some problems with my lungs after having long COVID. And some days I can't walk to the letterbox. But other days I could walk, well, I was going to say to Perth, but I don't think I could get quite that far. The temperature changes would make it hard to breathe. But I could walk a long way some days. Other days, not to my mailbox. But if you understand that as a healthcare worker, or if the system understands that, you can plan care that is going to meet my needs. It's not hard. It's not rocket science. And I know that we do a lot of work with patients with lived experience in the mental health space. I think we need to move beyond that, particularly into the area of chronic disease or chronic illness or chronic ill health, however you want to think about it. Chronic ill health is probably how I would think of it, because I think as an area we don't do it well in this country, in Australia, where I'm coming to you from. Um, and I think we have room for improvement there. But anyway, that's it. It's a very brief look at something that is in fact not, it's not hard to do, but it is foreign to us as healthcare workers, because we have to act like we know everything. We have to act like we are on top of what's going on. We're taught to be that way because our patients want that from us. You don't want to go and see a doctor who doesn't know what they're doing. It makes you afraid, and it makes you question your life choices. Let's be honest. So we're taught to behave like we know. We don't. I won't tell anyone if you don't. I think the easiest way to think about working with people who have lived experience is how to be nicer. There are other words I could use, but not in polite company. I'm sure you can figure out what I'm talking about. Anyway, that's lived experience, very briefly. I could say a lot more about it, but that's a very simple explainer about what it is and how it could help us and at the system that we work in. So thanks for your time today. Go away. I'll see you later.